Hello again, Dr. Jason Schlenker. Today we're going to talk about plantar fasciitis. I have a lot of patients coming in with plantar fasciitis, and there's a lot of stuff you can do at home to help yourself out. Obviously, if you come to the office, we can do a lot more for you, but at least in the time being, you can start doing some of this stuff and see if it doesn't help. So the first thing we have, I always recommend to all my patients, is a night splint boot. Okay, these look kind of cumbersome. If you've ever had a walking boot in the past, you can use that. You know, there's all kinds of options. I recommend people go on Amazon, but this is kind of the external splint. This goes around, your heel goes in here, and these straps come around and hold you in. Okay, you wear this at nighttime or as much as you can during the day. If you're sitting there watching television, put it on and hold you in position. Okay, the other one they have is a dorsal splint, so it goes on the top of your foot. Okay, these straps come around and just holds it on the top of your foot and holds your foot in a 90-degree position and helps that plantar fascia heal. The other thing I recommend to all my patients is to get one of these small water bottles, fill it up with water, and take the lid off and put it in the freezer. And then when you get home from a long day, if your plantar fascia is really bothering you, you put the lid back on it, so if it melts when you're doing it, it doesn't do anything, and then you just put it on the floor and you roll your foot back and forth on it and kind of do a little ice massage on your foot. So that's one option. The other thing you can do is get a tennis ball, or a lot of times people recommend golf balls. I don't really like golf balls because they're pretty hard and they can actually bruise the foot because it's almost like itching that scratch that really needs to be itched, so people push too hard. So this one, actually, I had a patient show me this one. This actually is a little rubber cat play ball. It actually works really well because you can really get in and rub pretty good, but you can't push too hard on it. Okay, we'll show you how to do that in a second. The other thing I recommend for a lot of people is a tennis ball or a racket ball. Again, great way to get in there and really kind of push on that plantar fascia without bruising it. Okay, if you really want to go hardcore, I would choose something more like a baseball because it's a little broader contact. The golf ball's too pinpoint of a contact and can bruise it. Okay, so those are some options for you. The other thing I recommend for a lot of patients are to get some insoles. Now, you don't have to go to an orthotist and get, you know, really expensive ones. What you can do is you can just go to REI and you can actually return them if they don't work. I get these ones, the sole. These are Dean Carnazzi sole. They also have the Super Feet at REI. They'll run you about 35 bucks or so. You can put them in your shoes, and that will really relieve a lot of pain. Okay, so I mentioned before the water bottle. So what you're going to do with the water bottle is when it's full, and it's iced up, you're going to put it underneath your foot, and you're going to roll it, just like that. You're probably going to want to roll your foot just a little bit to the medial side. Just a little bit to the medial side because it's going to get ice in that spot that's really painful. Right and through here and all the way up through the foot is where it's going to hurt the most. That's the plantar fascia. Okay. The other recommendation I have, like I said, this little cat ball. Okay, it's a little rubber kind of cat ball. You can put that on the floor. You're going to put your foot right on top of it. You're going to roll right along the spots that hurt. Usually right in the back there. Kind of right in the back is where it's going to hurt the most. So you're going to want to hit that one as best you can. Just roll back and forth till it feels, you get a nice little massage in there. Okay. The other option is, like I said, a tennis ball. So again, you're going to take your foot, you're going to roll up and down on the tennis ball or a racket ball. Okay, back and forth. You know, 10, 12 passes at least. You know, you can keep rolling as much as you want. They also have other options. They have kind of these little knobby sticks you can buy. Like sometimes they have them at Bed Bath & Beyond, whatnot. The other thing you can use is like a baseball. It's got a little bumps on it. So you put that underneath your foot. You can roll back and forth over it. Okay, the next thing is a calf stretch. So what you want to do is you want to find a wall. So I'm up against the wall. You put your foot back behind you, push your heel into the floor, and then lean forward. So you really want to have that foot flat on the floor. Okay, you're going to do a stretch like that. So from the side, it's going to look like that. The other thing you're going to want to do is make sure when you do that, a calf stretch, you're going to want to do one where you put all your weight on this back foot here. And you're going to kind of keep the heel on the floor and you're going to let that knee bend forward. That'll stretch a different part of the calf muscle, and it's really effective for plantar fasciitis to loosen up the Achilles and the calf. Okay, so for the plantar fasciitis, I hope this helps. Again, I'm Dr. Jason Schlenker, Schlenker Chiropractic. WestLinnChiro.com is the website, and 503-908-0582 if you need to get a hold of us. Thank you.